Welcome to the deep dive. We often hear the term glaucoma, right?
Mm.
But today we're going to really dig into what it actually means, specifically for our dogs and cats.
Oh, absolutely.
We've got some pretty detailed veterinary medical information here. And well, our goal is to kind of unpack this condition, understand the impact on our pets.
Exactly. And while, many listeners might have a general idea about glaucoma, the specifics for dogs and cats are, well, they're really important.
Right.
Things like the causes, how it's diagnosed, the treatments. It's key stuff for anyone who cares about animal health. We're basically here to pull out the critical info, shine a light on this threat to their vision.
Okay, so let's start right at the beginning. When we talk about glaucoma in dogs and cats, what are we fundamentally describing?
Okay, so at its core, glaucoma in pets.
Yeah.
It means there's too much pressure inside the eye. We call it intraocular pressure, or IOP for short.
Iowa P. Got it.
Think of the eye maybe like a little fluid-filled balloon. If that pressure gets too high, it starts damaging the delicate bits inside,
Like what?
especially the optic nerve and the retina,
Yeah.
the parts essential for sight. And that damage, well, it leads to vision loss eventually.
Okay, that makes sense. Are there specific pressure numbers we look for?
Yeah, there are. The numbers that kind of raise a red flag are a bit different for dogs and cats. For dogs, we usually get concerned when the IOP goes over, say, 25 to 30 millimeters of mercury mmHg.
25 to 30 for dogs.
Right. And for cats, that number is typically a bit higher, over 31 millimilliHg.
Okay. So how do vets actually measure this pressure inside a dog or a cat's eye? It seems tricky.
It takes special tools, yeah. There are a few ways. One is called applanation tonometry.
Applanation.
Yeah, a tiny, flat tip just gently touches the cornea, the front surface, and measures the resistance. That tells us the pressure.
Okay.
Another way is rebound tonometry. That uses a really light little probe that just sort of bounces off the cornea very briefly.
Ah, interesting.
And then there's Schiot's tonometry. It's an older method, uses a weighted instrument that rests on the cornea. And funny enough, even with the newer tech, vets sometimes still look back at this old human chart from the 50s, the Friedenwald chart, to help interpret those Schiot's readings.
Yeah.
But, and this is really important, a diagnosis isn't just about one high number.
Ah, okay.
We also need to see actual evidence of damage.
Mm-hmm.
Changes in the animal's vision or how the eye itself looks, or changes to the optic nerve or the retina.
Got it. So it's the pressure reading plus visible signs or vision changes.
Precisely.
Okay, so we know what it is high pressure causing damage, but why? What makes that pressure build up in the first place?
Ah, yeah, the why.
Yeah.
That's where it gets interesting. Glaucoma happens because the normal flow of the fluid inside the eye gets messed up.
Fluid inside the eye.
Yeah, it's called aqueous humor. It's constantly circulating, brings nutrients, keeps the eye shape, that sort of thing.
Okay.
Think of it like a sink with the tap always running.
Mm.
If the drain gets clogged, the water level rises.
Right. Makes sense.
It's similar in the eye. If that aqueous humor can't drain out properly, the pressure goes up. And we usually categorize glaucoma based on what's blocking that drain.
Okay. And what are those categories?
Well, first you've got primary glaucoma. This happens because there's an inherent problem with the eye's drainage system itself.
Like it didn't form right.
Exactly. We're talking about the filtration angles. That's where the fluid normally leaves the eye. In primary glaucoma, these angles might be too narrow or even closed off, or there could be a developmental issue called goniodysgenesis.
Mm.
Basically, the drainage structures just didn't develop correctly from the start.
And you said these often have a genetic link?
Yes, often there's a genetic component to primary glaucoma. Then the other type is secondary glaucoma.
Secondary, meaning it's caused by something else.
You got it. It happens as a result of some other eye disease or condition that's already there.
Can you give some examples of those secondary causes?
Sure. We see secondary glaucoma caused by things like primary lens luxation. That's where the lens inside the eye pops out of place.
Oh, wow.
Or anterior uveitis, which is inflammation inside the eye. Intraocular tumors growing inside the eye can do it too. Or even hyphema, which is bleeding into the front part of the eye.
So lots of potential triggers.
Definitely. But whether it's primary or secondary, the key thing, the really critical thing to remember is that if you don't control glaucoma, it's painful and it causes blindness. It seriously impacts the eye's health.
You mentioned genetics playing a role, particularly in primary glaucoma in dogs. Can we talk a bit more about that?
Absolutely. There's pretty strong evidence suggesting that those structural problems in the filtration angles, the ones leading to primary glaucoma in dogs, are inherited.
Inherited.
Yeah, though the exact way it's passed down genetically, well, that's still being figured out. but it's definitely not rare in dogs.
Really? How common?
Well, some reports show primary glaucoma accounts for, like, more than 0.8% of all admissions to veterinary teaching hospitals in North America. That's quite a bit.
Yeah, it is.
And secondary glaucoma isn't far behind. Roughly the same percentage, about 0.8%, across all dog breeds. But what really stands out is how certain breeds are just much more likely to get primary glaucoma.
Okay, so which breeds should owners be particularly aware of?
Right, so for that goniodysgenesis, the developmental drainage angle issue, several breeds pop up. A lot of Arctic Circle breeds think Norwegian elk hounds, huskies, malamutes, Akitas, Samoyeds,
Okay.
also the Bouvier de Flandre, Basset hounds, Chow Chows, Sharpei, and quite a few spaniel breeds, American and English Cockers, English and Welsh Springers.
That's a long list.
It is. And then there are other breeds that are prone to just having narrow filtration angles, not necessarily the full developmental defects. There's overlap here, Spaniels again, Chow Chows, Sharpei, but also some toy breeds like Poodles, Maltese, Shih Tzus.
Wow. And what about secondary glaucoma? Any breed links there?
Yeah, we see that too. For instance, lens luxations, which can cause secondary glaucoma, are more common in terriers and Shar Pei.
Bears and Sharpei.
And it's worth mentioning cats here too. In cats, primary glaucoma is actually pretty rare,
Oh, okay.
but secondary glaucoma is seen, usually linked to long-term inflammation, that uveitis we mentioned, or sometimes lens luxation again.
So if someone has one of these breeds or notices issues, when might signs typically appear? Is there an age range?
Yeah, there are typical patterns. Primary glaucoma in dogs usually shows up when they're middle-aged, say between 4 and 9 years old, generally.
4 to 9 years.
Right. Now, if it's secondary glaucoma caused by that primary lens luxation, that often hits younger dogs, maybe 2 to 6 years old.
Younger. Okay.
And then in cats, where secondary glaucoma is often tied to chronic uveitis, we tend to see it more in older cats, usually over 6 years old.
Okay. So what are some of the very first signs an owner might notice at home? What should they look out for?
That's a really key question for owners. And remember, you need a vet visit for a real diagnosis with the pressure measurement.
Right.
But signs at home. If it's a sudden onset, like acute angle closure glaucoma, you might see obvious pain, like squinting a lot. That's blepharospasm.
Blepharospasm?
Yeah, or they might be really sensitive if you touch near their head. Maybe some eye discharge, watery or mucousy. The eye itself could look cloudy or red.
Cloudy or red. Okay.
But here's the tricky part. If it's only in one eye at first, you might not even notice your pet is losing vision in that eye.
Ah, because the other eye compensates.
Exactly. Now, for secondary glaucoma, the signs can depend a bit on the underlying cause.
Makes sense.
If it's from uveitis, that inflammation, you might see signs of pain, maybe lasting a few days. The white part of the eye might look extra red. We call that scleral injection. And the cornea, the clear front part, might look hazy or cloudy corneal edema.
Glabellar injection, corneal edema.
Got it. And if it's from the lens popping forward, that anterior lens luxation, that often causes acute pain, that redness, again, the corneal cloudiness. And sometimes, if you look really closely, you might actually see the edge of the lens in the front chamber of the eye.
Wow, you could actually see the lens.
Sometimes, yeah.
What if the glaucoma develops more slowly? Or in cats, you said it might be different.
Yeah, chronic glaucoma can be sneakier. In cats with that long-standing uveitis leading to glaucoma, you might not see obvious pain at all.
No pain.
Could be. Instead, maybe you just notice one eye looks bigger than the other, like physically larger, but doesn't seem sore. Or the pupil in that eye might just stay wide open, dilated. Sometimes, really, the very first thing an owner notices, regardless of the type, is just that the whole eye seems enlarged. We call that buphthalmos.
Buphthalmos, so a bulging eye, basically.
Essentially, yes. Globe enlargement.
Okay, so an owner sees some of these signs, brings their pet in. What might the vet find during the actual physical exam?
Right. So in a dog with that acute primary glaucoma, the vet's first big finding will likely be really high IOP, often way over 30 mmHg.
High pressure check.
They'll likely see that squinting, the blepharospasm. Maybe the eyeball looks a bit sunken in, that's an ophthalmos. Redness of those deeper vessels on the white of the eye, the episcleral injection. The cornea will probably look generally cloudy, diffuse cloudiness, and the pupil. Likely dilated, wide open, and not reacting properly to light.
How do they test the reaction to light?
They'll check the menace response blinking when something comes toward the eye, which might be absent, and the dazzle response reacting to a bright light might also be gone. The pupillary light reflexes, testing how the pupil constricts with light, could be sluggish or totally absent, maybe in both eyes, even if only one seems affected initially.
And the inside of the eye, the optic nerve.
Initially, the optic nerve might look normal, but with that high pressure, it can start showing damage quickly. It might look pushed back or cupped, depressed.
Okay. And what about in cases that have been going on longer, the chronic or end-stage ones?
Right, in chronic cases, that globe enlargement buthalmus is much more likely.
The bulging eye again.
Yep. You might also see these little lines or breaks in the cornea called Descemet streaks, or sometimes Hobbs striae.
Obstree. Okay.
If the lens is shifted partially out of place, a subluxated lens, you might see this little crescent shape where you can see past the edge of the lens and a vagus crescent.
A phakic crescent.
And the damage at the back of the eye will be worse. You'll see optic nerve head atrophy, wasting away. And the retina might look overly shiny or reflective. That's tapetal hyperreflectivity, indicating retinal degeneration or necrosis.
Wow, significant damage.
Definitely. And if the glaucoma is caused by uveitis, the vet will see the high IOP, plus signs of that inflammation, the redness, the corneal edema, maybe inflammatory gunk floating in the front part of the eye. In those cases, the pupil might actually be small, myotic, or stuck to the lens posterior synechia, or the iris might even bulge forward, that's called iris bomb, because fluid is trapped behind it.
Iris bomb. Okay. We've touched on different types and what goes wrong. Can we just clarify again the specific root causes? What's fundamentally blocking the drain?
Sure. So just to recap, primary glaucoma, the root cause is those built-in abnormalities in the eye's drainage angle. They just don't let the aqueous humor flow out like it should.
Right, the developmental or structural issues.
Exactly. Secondary glaucoma, on the other hand, happens because something else is physically blocking that outflow.
Like what, specifically?
Okay, so in uveitis, it's inflammatory cells and debris, just gunk, clog it up the drain.
Makes sense.
If the lens luxates, pops out of place, the lens itself, or sometimes the jelly-like vitreous humor attached to it, can block the drainage pathway.
The lens physically blocking it.
Right. If there's bleeding in the eye, hyphema, then the red blood cells can accumulate and clog the outflow channels.
Okay.
And if there's an intraocular tumor, the cancer cells themselves can spread into and block the drainage system.
So various physical blockages in secondary glaucoma.
Precisely.
Who then is really at the highest risk? Are there clear risk factors owners should know about?
Yes, definitely identifiable risk factors, especially for the secondary type. As we've kind of discussed, if your pet has a history of uveitis, lens luxation, hyphema, or an eye tumor, their risk for secondary glaucoma goes way up.
Okay, those underlying conditions.
Absolutely. Also, something owners should be aware of. Certain eye drops used to dilate the pupil, mydriatics could potentially trigger an acute glaucoma attack in an animal that's already predisposed but hasn't shown signs yet.
Oh, interesting. So be careful with eye drops.
Worth discussing with your vet if your pet might be predisposed, yes. And a really crucial point for primary glaucoma in dogs. Even if just one eye looks affected now, you have to consider it a bilateral condition.
Bilateral meaning both eyes.
Yes. The other eye is also at high risk. It's strongly recommended to get that seemingly healthy eye checked by a veterinary ophthalmologist. They can assess the drainage angles and give you an idea of the future risk.
That's really important advice. Okay, how do vets actually nail down the diagnosis? How do they tell it apart from other things that make the eye look red or sore?
Diagnosis really comes down to a good eye exam and, absolutely critical, measuring that intraocular pressure with a tonometer.
Tonometry is key.
It really is. Because when a pet comes in with a red, maybe painful eye, what vets sometimes call a red eye, there are a few possibilities, like conjunctivitis, just inflammation of the outer lining. That causes redness, sure, but the IOP is usually normal and the pupil isn't dilated. The redness also tends to look different, more superficial.
Okay.
Uveitis can also cause a red eye, but often, at least early on, the IOP in uveitis is low, maybe even below normal, and the pupil is usually small, constricted.
So pressure is the big differentiator.
Tonometry usually sorts it out, yes. It's really the cornerstone for distinguishing glaucoma.
Are other tests like blood work useful? Or imaging?
Standard blood tests, CBC, chemistry, and a urinalysis are typically normal if it's primary glaucoma. But if it's secondary glaucoma, those tests might show clues about the underlying cause. Like, if there's bleeding from a clotting problem, the blood work might show that. If uveitis is suspected, maybe blood tests for infectious diseases could help pinpoint the cause of the inflammation.
I see.
And sometimes, imaging like chest x-rays or an abdominal ultrasound might be done. especially if they suspect a systemic issue like a fungal infection or cancer spreading that could be causing the eye problems.
Right, looking for a bigger picture.
Exactly. And ocular ultrasound, an ultrasound of the eye itself, can be super helpful if the inside of the eye is too cloudy to see clearly during the regular exam.
Makes sense. You've mentioned specialists a few times, veterinary ophthalmologists. When is seeing one really necessary?
Honestly, for any suspected acute case of glaucoma, getting a referral to a board-certified veterinary ophthalmologist is really the best move.
For acute cases, especially.
Yes, they have specialized gear and critically the expertise for a super detailed exam of both eyes. They can perform gonioscopy.
Gonioscopy.
Yeah, that's where they use a special lens to directly look at those drainage angles we talked about.
Ah, okay.
They might also do an electroretinogram, an ERG, that measures the retina's electrical activity. It helps gauge if the eye might still have potential to see again with treatment.
Does a good ERG guarantee vision will return?
Not guarantee no,
Oh,
but a normal ERG is hopeful. A very abnormal one suggests vision recovery is unlikely. And sometimes, if an eye has to be removed surgically, enucleation examining the tissues under a microscope, histopathology can confirm glaucoma by showing characteristic damage, like angle collapse, loss of nerve cells, photoreceptor damage, and that optic nerve cupping.
okay, comprehensive diagnostics. Let's shift to treatment. What's the general approach for managing glaucoma?
Okay, treatment. For acute glaucoma in dogs, the first step is usually immediate, intensive medical treatment. Sometimes they need to be hospitalized. The goal is to slam that pressure down fast to try and save vision.
Intense initial treatment.
Yes. And after they go home, frequent checkups are vital, often daily or every other day for the first week, just to keep monitoring the IOP and make sure the meds are working.
Wow, daily checks.
It can be that intensive initially. And owners of dogs with primary glaucoma need to understand this is a disease of both eyes.
Right, the bilateral risk.
Exactly.
Yeah.
Even if the other eye looks totally normal now, without preventative treatment in that eye, over half of those dogs, more than 50%, will get glaucoma in the second eye within about 8 months.
8 months, that's fast.
It can be. And unfortunately, even in the eye that was affected first, even with treatment, a lot of dogs, maybe up to 40%, still end up blind in that eye within the first year.
That sounds pretty tough. Is surgery an option? Does it help the odds?
Yes, surgery is definitely an option, and often it's considered the best bet for longer-term control, especially for primary glaucoma or glaucoma caused by lens luxation.
Better than just meds.
Often, yes. Many dogs with primary glaucoma treated only with medications will, sadly, go blind within that first year. Surgery aims to either improve the fluid drainage, maybe by implanting tiny shunts or valves.
Drainage devices?
Right. Or the other approach is to reduce how much fluid the eye produces in the first place.
How do they do that?
Techniques include laser cyclophotocoagulation, using a laser on the part of the eye that makes the fluid, or cyclocryosurgery using freezing for a similar effect. There's also a newer technique using an endoscope with the laser, which might be even better at keeping pressure normal and preserving vision.
Okay. And what if it's caused by the lens being out of place?
If it's secondary to that anterior lens luxation, surgically removing the dislocated lens can sometimes save vision and lower the pressure.
Makes sense. Remove the blockage.
Exactly.
Yep.
Now, for eyes that are already blind and painful from glaucoma, surgery is still an option, but different kinds. Enucleation removing the whole eye, or evisceration removing the inside contents and putting in a prosthesis, like a cosmetic implant. And sometimes, injections directly into the eye can be done to try and control pain and reduce the need for long-term pills.
What about the medications themselves? What kinds of drugs are used?
Right, the meds.
Yeah.
In those acute situations, especially in dogs, we often hit it hard with a combination of drugs to get the IOP down quickly.
A cocktail approach.
Kinda, yeah. This can include prostaglandin analogs like latanoprost, travoprost, bimatoprost. They help increase fluid outflow. Also, miotics, drugs that constrict the pupil like pilocarpine or dimecarium bromide, can help drainage.
Okay, drugs for outflow.
Then there are drugs to reduce fluid production. Hyperosmotic agents like IV mannitol or oral glycerin pull fluid out of the eye quickly.
Like emergency pressure relief.
Pretty much. And carbonic anhydrase inhibitors, these can be oral, like methazolamide, or topical eye drops, like dorzolamide or brinzolamide. They reduce fluid production.
Carbonic anhydrase inhibitors.
Yep. And finally, topical beta blockers like timolol, levobunolol, or betaxol. They also decrease fluid production.
So attacking it from multiple angles.
Exactly. Now, if the glaucoma is secondary to lens luxation or uveitis in dogs, The meds are often similar, but we usually avoid miotics, the pupil constrictors.
Why avoid miotics then?
They can sometimes make things worse in those specific situations, like potentially trapping the iris. And with uveitis, we can often use topical steroids to fight the inflammation, as long as there's no ulcer on the cornea.
Okay. What about cats?
For cats, where it's often that chronic smoldering uveitis causing secondary glaucoma, treatment might involve topical steroids, beta blockers, and those carbonic anhydrase inhibitors.
Are there any medications that are a definite no-no or need special care?
Yes, absolutely. Topical atropine generally avoided in glaucoma. Miotics, as I said, usually avoided with anterior lens luxation or active uveitis. And it's usually best not to double up on drug classes like don't use 2 different miotics or 2 different beta blockers or 2 carbonic anhydrase inhibitors together.
Stick to one from each category.
Generally, yes. And some drugs need caution. Pilocarpine drops can be irritating, might worsen inflammation sometimes. Topical beta blockers, if absorbed into the system, could potentially cause slow heart rate or breathing issues, especially in small pets.
Side effects to watch for.
Right. Oral carbonic anhydrase inhibitors can cause metabolic acidosis, may be seen as panting, weakness, seeming out of it. Osmotic agents like mannitol need care in pets with heart or kidney disease. Glycerin shouldn't be used in diabetics as it raises blood sugar.
Okay.
And there's a potential drug interaction. Democarium bromide, one of the miotics, could increase the toxicity risk if used alongside certain old-school organophosphate fleetic products. Unlikely now, but good to know.
Good point.
Also, importantly, regular diuretics like Lasix, furosemide, they don't work for lowering eye pressure.
Okay, good to clarify. So what does the long haul look like? How is this managed over time?
Long-term management is all about regular IOP checks. Really frequent at first, like we said, maybe daily, then weekly, then maybe monthly or every few months once things stabilize after starting or changing meds.
Ongoing monitoring.
Absolutely. If the pressure stays well controlled for a good while, the vet might try to carefully taper down the dose or frequency of some meds. And for primary glaucoma in dogs, again, that other eye needs close attention.
Checking the good eye.
Yes, assessment by an ophthalmologist is key. They might recommend starting preventative drops in that eye, maybe dimecarium bromide, latanoprost, timolol, dorzolamide to try and delay glaucoma starting there.
Proactive treatment for the second eye.
Exactly. The main long-term risks or complications are, of course, irreversible blindness and chronic eye pain. Glaucoma is usually a lifelong condition needing ongoing management.
Lifelong.
Typically, yes. And while medical treatment alone often ends in blindness eventually, surgery gives a better shot at keeping vision longer. Though even with surgery, vision might not last much beyond, say, 2 years from diagnosis in many primary cases.
2 years even with surgery. Okay.
Right.
What about secondary glaucoma?
The outlook there can be a bit more variable. If it's from a lens luxation and the surgery to remove the lens goes well without complications, the prognosis for vision and comfort might be fair to good. Similarly, if it's uveitis-induced glaucoma and the underlying inflammation can be really well controlled, the prognosis might be fair. It depends heavily on managing the primary cause.
Okay. This has been incredibly comprehensive. Thank you. To wrap it all up, what are the absolute key messages you want listeners to take away?
I think the biggest things are glaucoma in pets is serious. It needs quick diagnosis and careful, consistent management. Remember the differences between dogs and cats. Primary glaucoma being a big issue in certain dog breeds, often genetic.
Right.
While secondary glaucoma caused by other eye problems is more common overall in both species.
And the importance of getting the right help.
Absolutely critical. Getting a veterinary ophthalmologist involved, especially for primary cases or for checking that other eye, is often crucial. Early expert intervention gives the best chance to save sight and keep the pet comfortable.
That definitely comes through loud and clear. You know, this really makes you think, given those strong breed predispositions, especially for primary glaucoma in dogs, what are the ethical considerations here for breeders, for owners, regarding screening, maybe prevention of a disease that can cause blindness? Something to mull over. Thank you so much for sharing all this insight today.
My pleasure. It's such an important topic.